Why do strokes cause vision changes and eye strain? Have you ever wondered why strokes can lead to vision changes and eye strain? It's a complex issue that involves how strokes affect the brain's ability to process visual information. The brain has specific areas dedicated to vision, including the occipital lobe, which is the main processing center located at the back of the brain. When a stroke occurs, it can disrupt blood flow to these critical areas, leading to various visual impairments. One of the primary reasons for vision changes after a stroke is damage to the visual pathways. These pathways extend from the eyes through the optic nerves to the occipital lobe. If a stroke affects any part of this pathway, it can result in visual field loss. This condition is known as hemianopsia, where a person loses half of their visual field in one or both eyes. Some may experience field cuts, leading to blind spots or reduced peripheral vision, making it difficult to see objects on the sides. Another significant factor is impaired eye movement control. Strokes can damage the brain regions responsible for coordinating eye muscles. This can lead to eye movement disorders, causing double vision or difficulty focusing. As the eyes struggle to work together properly, eye strain can occur, making it uncomfortable to read or focus on tasks. Visual perceptual disorders also play a role. Vision is not just about seeing, it involves interpreting visual information. A stroke can impair this ability, affecting depth perception, color recognition, and spatial awareness. Everyday tasks like reading or navigating can become challenging and tiring for the eyes. In some cases, strokes can lead to retinal ischemia, which is a lack of blood flow to the retina. This can directly damage the eye and cause vision loss. Stroke survivors may also have existing eye diseases, such as diabetic retinopathy or cataracts, which can worsen their vision problems. Another interesting aspect is visual neglect. Some strokes can cause the brain to ignore one side of the visual field. This is not an eye problem but rather a brain processing issue. It can create the sensation that part of the visual world is missing, leading to additional eye strain as the brain tries to compensate. Eye strain often results from the brain and eyes working harder to adapt to these impairments. The effort to focus and interpret visual information can be exhausting, especially when eye movement control is disrupted or when visual fields are partially lost. Understanding these causes is crucial for recovery and rehabilitation. Vision rehabilitation therapies can help improve eye movement control and teach techniques to compensate for visual field loss. Early vision screening and tailored rehabilitation can significantly enhance the quality of life for stroke survivors dealing with vision changes and strain. In summary, strokes cause vision changes and a strain by disrupting the brain's visual processing centers and pathways, impairing eye movement control, and potentially causing direct damage to the eyes. These effects combine to create challenges in how vision is perceived and used, leading to visual deficits and increased eye fatigue. If you or someone you know is experiencing these issues after a stroke, it is essential to consult healthcare professionals for personalized advice and support.